To start off, I'm going to hand it over to Donna, and she is going to present and provide you an overview of the MedLab program.
Thank you, Debbie. Welcome, everybody. Thanks for fighting the rain to get here tonight. I'm really excited that you made it. This is a profession that's near and dear to my heart. I am what you will become if you enter our program. I'm a medical laboratory scientist, and I have worked in the field for about 25 years before coming over to the education side. And I still hold a valid position in the field at two of our clinical partners. So I'm very excited to be here and have the opportunity to talk to you about this profession. I think the first thing we should do is we should start with an overview. We've got a nice video here from Work BC, which will give you a general example of what it is we actually do when we become a medical laboratory professional.
Our next career plays a vital role in the field of medical science. We're in the lab today to meet a medical lab technologist. Hi.
Hi, I'm Jody.
I'm Brian.
Nice to meet you.
Nice to meet you.
Let's get a lab coat on and get you started.
Great.
My name is Jody Simmons. I'm a medical laboratory technologist, and we're at the Dawson Creek and District Hospital lab. Medical laboratory technologist works in the lab. They run patient samples, blood and body fluids. They're tests that are ordered by a doctor, and we run them on instruments, and we make sure that those results are accurate and precise before we release them to the doctors. A typical day would involve coming in and waking up all our instruments, and then we would have to pull quality control material to make sure that our instruments are running correctly. We would be doing any maintenance, like pulling apart the instrument and cleaning it before we would want to run any patient samples.
What is this machine?
We're looking at the inside of a chemistry analyzer. So when someone, for example, comes in the hospital with a heart attack or a suspected heart attack, this is actually one of the instruments we use to see if there's been damage. So you're always learning about new instruments. Your day is always different. Your day is never the same. You might be learning a new instrument, a new technology. In a small lab like this, we are required to draw blood sometimes, so we'll draw the blood and bring it back to the lab. We're looking at tubes, and I'm going to tell what this person's blood type is by using my reagents and these tubes. So if you're an A pos patient, or if your blood type is O, I'll be able to tell from these tests.
Okay.
You're putting drops in tubes, and you're using pipettes and small equipment, and you're doing maintenance, so it's good to be able to work with your hands. It's good to be very organized, so you can organize your workflow and compartmentalize because you have priority specimens as well. You might get pulled from one thing and there's a stat that comes in and it's a lot more, has priority over a routine sample, and you need to stop what you're doing and work on that stat specimen from the emergency, for example. Always double check your work, because you do not want to make a mistake. This person's bleeding in the merge and they need blood quickly. You need to work quickly but accurately as well. I don't think people realize how closely we work with other healthcare professionals. We work with nurses and doctors quite a bit. So the centrifuge is slowing down. It has spun the two samples together. So basically my patient's cells have just been spun. But if you look here, this is my tube. That there is a blood clot. That's a agglutination of a patient's cells.
So because the blood clumped together within this solution, you know that this is what type of blood?
This is an A person.
Okay.
Because I put A reagent in and the blood clumped, you have an A person. We work shift work, so we have day shifts. Our day shifts start at 7:30 to 4, and then we have a person coming in at 2:30 till 11 o'clock at night, and they're our evening shift, so they're on call all night until the next morning. I was interested in chemistry and biology in high school, and then I went on to get a university degree in biochemistry. There is a degree you can get for medical laboratory technologists, but I have a certification and it's a diploma, so it's a 2.5-year program. The advantage of having a degree over the diploma is you do get paid extra, and you can also take a management position a little easier than that. But the diploma, everybody is certified. You take a certification exam, and everybody is considered certified, and you can work anywhere in Canada. There's always opportunities to further advance your education. You could specialize in another department like microbiology. Also, the CSMLS, which is our certifying body, offers courses online that you can take and further advance. My advice for somebody straight out of school would be to go and do a lab tour, talk to somebody that works in a lab. A good medical laboratory technologist pays attention to detail. They're considerate to others. They really do care about the well-being of people, even though you're not in the forefront and people don't always see you. It's nice to know that you're having an impact on somebody's life.
Jody, thank you so much for showing me around.
Nice meeting you. Don't forget to wash your hands.
You got it. Thanks.
Bye.
Once again, I'm Brian for Career Track, reminding you that this career could be yours. See you next time.
As we move along, you'll probably have a number of questions about the profession, and we're very happy to answer those for you. Advising is here to also answer your questions, but we're going to ask you to hold those questions until the end of the presentation, and we'll deal with all of them at the same time if that's workable for you all. So let's talk a little bit about what a medical laboratory technologist does. From the video, you saw that we work with all sorts of patient samples. We're there to help with the diagnosis of all disease systems from all parts of the body. So if you are very scientific minded, if you like biology, if you like technology, this field may be a good fit for you. We work with all kinds of high-tech instrumentation, and that's also something that some of you may find very fascinating and intriguing. If you like manual science, then there's lots of opportunity to engage in those sorts of activities as well. Where do we work? Well, the landscape is full of opportunity for you if you choose this profession. You can work in hospitals or private labs. You can work for a technical instrumentation company in sales. You can work in public health facilities like the Center for Disease Control or the British Columbia Center for Disease Control, biotech companies, fertility programs and companies. So there's lots of opportunity for you in this field to be very diverse. What about the career outlook? The career outlook is great. There's a human resources deficit not only in BC, but it's Canada-wide. So our students are in high demand. Most of our students are hired before they finish the program. They're hired when they're in their practicum. And last year, 100% of our students that graduated from the program were hired. So the outlook is fantastic. And you'll be working very closely with allied health and doctors and nurses. And it's a very enjoyable, very exciting career. What are the disciplines? Again, I talked about diversity and opportunity in this profession. There are 6 separate areas to work in, and one of them is clinical chemistry. If you have a love for chemistry, this might be a good fit for you. There's a lot of high-tech automation when you work in chemistry. You're doing things like drug screens and working on hormones that might indicate disease processes like heart attacks or those sorts of things. It's very exciting. Histology is about the study of tissue. So if you were working as a histotechnologist, you would be helping the pathologist identify changes in tissue that might mean there's a cancerous process going on, those sorts of disease processes that are associated with tissue. Molecular diagnosis. I don't know if many of you have post-secondary already, but if some of you have taken molecular in university, this might be an avenue where you might want to explore. It's up and coming. The research facilities are using a lot of molecular to diagnose disease in humans, and it's a field that is right on the cutting edge. It's very exciting. So you would be qualified to work in that area when you graduate from the program. Transfusion science is as it implies. This is the study of blood and the antigens and antibodies that are in all of our blood systems, and being able to identify what is in our system so that we can make blood compatible for patients that may be bleeding or require blood products if they're a hemophiliac or have other processes that require infusions from healthy individuals. So that is transfusion science. Microbiology is my specialty, and you spend a lot of time identifying organisms that may cause disease in human beings, viruses and bacteria primarily, but there are other organisms that you would learn about as well, and you learn about being able to differentiate between those that help us stay healthy and those that cause disease in us. Hematology is the study of blood. So you would be learning the difference between what normal cells in our blood look like versus abnormal cells. And you'd be doing things like helping the pathologist, or the hemopathologist in this case, diagnose things like leukemias and other cellular blood disorders. Is this profession for you? Well, that's something that you really need to think about and consider. If you're curious, or if you love science like I do, if you're process-oriented, which means that you're a bit of a linear, detailed thinker, this might be for you, because we have to follow the standard operating procedures very closely. Everything is monitored, everything is checked twice to make sure that what we are doing for the patient is actually going to help them, is actually accurate. So it's a very precise science. You have to be self-directed and self-sufficient. When you graduate from this program, you're going to be working very autonomously. You're not going to have somebody side by side collaborating with you at every step and every decision you make. You have to be very self-sufficient and self-aware. And we will train you in such a way that you feel confident in that arena. Okay? We need you to be accountable, and we need you to be responsible, and we need you to be authentic and honest. And authentic and honest is not on the slide, but it's something that's very important because of what I just said. We work very much by ourselves, and we are human, and we do make mistakes. And if we aren't able to admit to our mistakes, we can do serious harm to a patient. So we definitely want individuals that are honest and forthright. Every mistake can be corrected, but we need to know about it. Why BCIT's MedLab Science? I started off by saying 100% of our grads were hired last year, and most of them were hired on before they finished the program. We're very highly regarded, not only in the province, but Canada-wide and beyond our borders. Many of our students go on to write the ASCP, which is the American board exam, and we're very, very qualified to work in the States, and they love Canadian MLTs in the States as well as in Australia and the UK. So your borders are very broad if you come to BCIT for your program. It's a cohort model, so what does that mean? The 80 students that we bring into the program stay together from day one until you finish your didactic at BCIT. Your didactic is your theoretical studies. So all of you stay together. And further than that, if you are attending your labs, we break you down into 4 groups of 20, and you get to know your pod of 20 very, very well. And you have this great network, not only of friends, but colleagues to support you through the program. Your instructors are like myself. We come from industry, we understand what's happening out there, and we invest in you because we choose you when you come into this program. We're invested in your success, and we're there to help you every step of the way. We're an accredited program, which means that we have to obtain our high standards. And this accreditation process happens every 4 to 6 years, depending on the type of accreditation you receive at the time. And that's constant and ongoing, and it's rigorous, so our standards here at BCIT are very, very high for the faculty and the program itself. And we talked about national certified. You can work anywhere in Canada once you write and succeed on your CSMLS exam. What does the program map look like? What are your 2.5 years here at BCIT going to look like? We have a January intake, which most of you are probably already aware of, and that will run from January to May, and that's level 1. Then we have the 2 intermediary didactic sessions, level 2 and level 3. And when you start into level 2 and continue on into level 3, that is when you will dig deep into the science that you're going to be performing when you graduate and when you become an MLT. So it's very specialized, it will help you be job ready, and it's a beautiful bridge into the employment network. Level 4 and 5 are your full clinical terms. So I said this is a 2.5-year program. Of that 2.5 years, 9 months are spent solely in clinical with no return to your didactic. So it's full-on immersion in the clinical site. A lot of fun, and again, gets you ready for the job market. And from that jumping point, most of you will be offered a job at your training site. There are some risks, and you need to be aware of them. You are dealing with human samples, whether it be blood or body fluids or urines. You're also dealing with a lot of very toxic chemicals, so you need to be safe and you need to be aware of that. And again, there are standard operating procedures that you will follow to make sure that that all happens. And we will teach you about all of these things and about all of the safety concerns around these things and how to protect yourself and how to protect your patients. But it's really important to investigate this before you jump into this profession because there are risks associated with it. We do make sure when you come into the program that you have the appropriate immunizations to keep you safe. And we do monitor that. And we also need to keep our patients safe in the hospital, so there will be things like criminal record checks that you will have to do before you come into the program as well. What does it take to be successful? And I would say this is probably a general slide to BCIT as a whole, not just to our program, but you need to have good time management skills. The programs at BCIT are rigorous, and they're different from other post-secondary. They're different from your time at UBC or your time at SFU if you have post-secondary, because as we know, there's big gaps between when you go to school and the different courses that you're taking. You can have a lot of time off, and you can still work a lot of the time. You can at BCIT as well, but it takes skill in time management. You have to have a willingness and an openness to ask for help. Because even though some of you may have full degrees already, maybe in biochemistry or in biology or in molecular science, clinical chemistry, clinical microbiology, clinical molecular is very different, and it's all new learning. And you're going to think you can rely solely on your past education, but you won't be able to. And it's really important that when you feel overwhelmed and when you are struggling, that you have the courage to ask for help. And if you do, as I said earlier, we're all there for you. We're all there to support you because we choose you. We choose students that we think are going to be good technologists and are going to be successful in our program. You need good English skills, good communication skills, not only while you're here at BCIT so you can collaborate with your fellow students and your instructors, but you need to think forward about what you're going to be doing when you actually graduate from this program. We want to make sure that you're a solid communicator with the other healthcare professionals that you're going to be working with, doctors, nurses, allied health, because you are an integral part of the entire healthcare team and you need to be able to express yourself well. Computer literacy, I think we all need that all the time now. Technology is not slowing, it's moving forward at light speed, so that goes without saying. And the last bullet is physical and emotional health. BCIT is stressful. It is. I'm not going to sugarcoat that. So you need to be able to manage your stress and know when you're not managing your stress and reach out and do the things that you need to manage your stress, whether it be taking some time at rec services and going and playing a game of dodgeball, or whether it be taking a walk with a friend, or whether it be reaching out to somebody in counseling services for support. You have to be able to self-regulate and manage stress. Physical health, also very important, because you'll find in this profession you spend a lot of time standing. You're a scientist, so you spend a lot of time on your feet, whether you're working with a high-tech piece of equipment or whether you're working on a cross match, you're on your feet a lot. So physical health is very important. And the process to apply, I am going to pass it over to my colleague, Deborah Power, to talk about this. She is an expert in this process. So, Debbie.
Hi, thank you, Donna. First and foremost, I want to emphasize that this is a competitive program. So when you go to apply, you need to make sure that you are applying with a complete application. That means you need to ensure that you've fully met all of your prerequisites, preferably with final marks. And you need to apply before our deadline of June 1st. If you have applied on or before that June 1st deadline date, we will invite you to participate in our selection process, which is a multi-mini interview process. When you go through that MMI process, you're evaluated at a number of stations, some of which are scenario questions, some of which are activity stations. We evaluate you at each of those stations, and then your evaluative scores from each station are totaled, and the top 80 ranked individuals are offered seats into the program. If you are not one of those top 80 students, but you have successfully completed the MMI process, you will be waitlisted for that intake. And those of you who are offered seats into the program will then be asked to submit a clinical records check as well as a complete immunization review. So with that, I'm going to hand it back again over to my colleague Donna to continue on with the clinical placement.
Thanks, Debbie. Clinical placement, this is my wheelhouse. I'm your clinical coordinator when you come to the program. So there are 2 clinical placements that you will go through. The first one happens right after level 1. So you would arrive here in January, you would do your theoretical studies from January to May, and then in May, end of May, early June, you would go out for a 2-week phlebotomy practicum. And this practicum takes place at one of our clinical partners, and I counted them today. We have 17 clinical partners, and our clinical partners are spread throughout the province, so it's really important to understand when you come into this program that you could receive a clinical site that is not on the Lower Mainland. So you have to be prepared to accept a seat in a clinical placement anywhere that the BCIT MedLab Science program has an affiliation agreement. All right, so just, and I believe they're all on the website so you can have a look, or you can question me about that, where they are later and how many seats are in each clinical placement after the presentation if you have questions about that. Your second clinical placement is a long block clinical placement, and it happens after you finish your didactic level 3 studies, and it's a 9-month clinical placement, as I already indicated. This is the full immersion clinical placement, and it happens from July through to the following May. And after your full immersion clinical placement, you would be eligible to write your CSMLS exam. It is a competency-based program, and what that means is there are certain skills that you will have to perform and be successful and be evaluated on by your clinical instructors in order to be recognized as competent and eligible to write your CSMLS exam. So you take that theoretical knowledge that you learned while you were here at BCIT, and you bring it forward and you apply it in the real world situation. That's what competency-based programs are made of. The selection process for your clinical site is an automated online method. It's called HSPNet, is how we approach this. And each student is given an opportunity to pick their top 5 clinical sites. The computer works its magic and it tries to slot as many of the 80 students into one of their 5 choices as possible. Now we do hold sites in Cranbrook and Trail, and we have students from those areas that like to go there sometimes, but if all of you in a cohort of 80 all want to go to St. Paul's, they only have 10 seats, so 70 of you are going to be unhappy. 80 students, 80 seats. So somebody has to fill each one of those seats, and it's really important to be aware of that. But we have great support at all of our clinical partners, so we wouldn't send you anywhere that we don't feel comfortable that they're going to be very supportive of you, and you're going to have a successful time there. Our clinical partners are from many different health authorities and private labs. We have Fraser Health, which is a clinical affiliate, Interior Health, so we're talking about places like Kelowna, Kamloops, Vernon, Penticton. Life Labs, they have 2 sites where they take students, one here in Burnaby and the other is on the island. Provincial Health Authority encompasses places like BC Children's and Women's. Providence Health would be St. Paul's. Vancouver Coastal would be places like Lionsgate Hospital, Vancouver General, Richmond, those sorts of hospitals, and Vancouver Island Health Authority. We no longer have seats on the North Island because all of the microbiology has been consolidated to South Island. So all of our clinical seats on South Island are in the Victoria area. We talked about the 2-week phlebotomy placement, and last time when we had this info session, some students didn't, or some potential students didn't understand what the phlebotomy word meant. It means primarily blood collection, and you will be doing that. You will have to pass competencies in that area. Don't worry if that concerns you. You will be well trained here when you go out, and it'll be easy for you. You'll just be continuing on what you've already learned here. We do work shifts. You have to be aware of that, and some of you will be doing some shift work when you're in your clinical placement. Some hospitals do assign their students a week or 2 of afternoon shift and a week or 2 of graveyard shift. Be aware if you become a medical laboratory professional, when you first graduate, these are likely the shifts that you will be working. If you never want to work an afternoon shift or a graveyard shift, unless you land a job at a private lab, you're probably going to be surprised and find that you are working some of those shifts at least early in your career. Students are responsible for your own transportation and accommodation when you're on your clinical practicum. So if you secure a seat in Kelowna and you're a Lower Mainland individual that's lived down here, you have to be ready to go to Kelowna for your 2-week practicum, and if it means getting a hotel for the 2 weeks you're there or staying on at University of BC OK for a couple of weeks, that's up to you to manage. I will help you though. If you come talk to me, if you're struggling, we can work something out, maybe talk to former students that are up there and try to help you ease into that rotation. When you go there for your long practicum, you'll definitely have to do a lot of the legwork yourself. Okay? And that pretty much concludes my presentation, so I'm going to hand you over to my friend from Program Advising to help you with the global BCIT things.
Thanks very much. Thanks, Donna. So my name is Jesse Taylor, and I work in the Program Advising Department at BCIT, along with a number of my colleagues. And as mentioned, my colleague Janice is sitting here as well to assist with questions at the end, and talk a little bit more about what we help students with as they're seeking out programs at BCIT. So we're going to talk to you guys a lot about the entrance requirements to gain entry to these programs, clarify some of the exam options that might be available or different upgrading options. We'll talk about some basic things like costs, deadline dates, timing of the programs, as well as competitive aspects that you need to be aware of when you're thinking about a program that would be competitive, such as this program. There's also just different aspects of the application process that we'll try and cover as well. And so some of these slides that I'll be going through will be covering those aspects. So we do have the academic requirements that are necessary for entry to this program. I'm sure many of you have taken a look at them on the website. They'll be listed in the program entry section of the program page. And so you're looking at English 12, Math 12, you've got your Biology 12, Chemistry 12, and then your Physics 11. Several of these are going to be required for recency. So they are asking that within the last 5 years, you've compensated for these academics. And so that'll be the Math 12, the Chemistry 12, as well as the Biology 12. And then again, just to reiterate, the application deadline of June 1st, which is really important. So you ideally want to go ahead and proceed with the application process as early as you have the opportunity to. But as Debbie had stressed, ideally it's best if you have the ability to provide final grades when you apply to the program. So to proceed with that. And of course, refer to the information online. There's always the chance that things are changing over the years, and so you want to make sure that you keep on top of that information. Of course, midterm grades can be used, but again, some of the health departments especially have stressed that it's ideal to provide final grades. It gives a better sense of how you're doing in a course, as opposed to just that 50% midterm grade, but it is an opportunity for you to proceed with your application with that midterm grade initially, if you'd like to proceed. And then of course, there's challenge exams as well, especially when you're needing to meet that recency requirement. So that if you've completed that subject area, especially if it's been outside of the 5 years, you have that opportunity to proceed with the challenge exam if you feel that you have the competencies to proceed with that. And then document submission is generally going to be done electronically through the online application process. So we'd ask that you scan an official copy of your transcripts and upload those to the online application process. And of course, you'll apply online through bcit.ca/apply, and there'll be a link on the program page as well. Important dates to be aware of as you're proceeding with the application. You've got your interviews that are going to take place after the application process is proceeded, and we've passed that June 1st application deadline, so you'll receive notice from the department about when you'll be scheduled for that interview process. And then shortly after the interview processes are completed, there'll be notification provided to all of the applicants. And of course, so again, June 1st will be the application deadline, and then the first couple weeks of June, the department will proceed with the scheduling of the interviews, and then by the end of June, they hope to have everything wrapped up and everyone notified of the process. There's a few other departments on campus that are really important to your success here. Financial aid is one of the first ones that would come early on in the application process. But as was mentioned before, there's several departments that are going to be key to your success here in the way of support. It's ideal to get out and utilize the recreation services so that it's not just your academics that you're focusing on, but you have that chance to relieve some stress, get on one of the bikes in the newer facility. There are things like Netflix that are in some of the equipment, so sit there, watch something entertaining, and complete that exercise at the same time. You've got student employment services that are an additional service that will be helpful after you've completed your studies, if you need that additional support there. Student association as well, there's a lot of things that you can get involved in through them, especially the clubs that are available for certain student groups. So get involved there. And utilize things like peer tutoring and the library beyond your instructors and your classmates, which are going to be a great support group as you move your way through the program. Additional resources in the way of social media. You can always get access to more information through some sites like Facebook. You're looking at YouTube at certain videos that we have posted online that refer to this program or some of the other programs that we offer. And then of course, things like Flickr are going to show you some examples in the way of imagery and otherwise. And then, of course, getting back to our department, we're available on campus 3 days a week. So you can come in and see us in person Tuesdays and Thursday afternoons, as well as Wednesday mornings. And then every day of the week, except for Wednesday mornings, we're taking phone calls as well. So if you can't make your way to campus, certainly reach out and make contact by phone. And then as well by email. If, again, outside of regular hours, you need to ask a question, send that in to us, and then we'll get back to you in an appropriate time frame. And the advising page will have reference to all these service periods. It's best to take a look at that in advance, especially if you're planning on coming to campus, because the hours do change certain times of the year.